What are the eligibility criteria for stroke? Have you ever wondered who can receive tissue plasminogen activator, or tPA, for stroke treatment? This powerful medication is used in cases of acute ischemic stroke to dissolve clots that block blood flow to the brain. However, not everyone is eligible for this treatment. Let's break down the key eligibility criteria in a straightforward way. First, timing is crucial. tPA is most effective when given within 3 to 4.5 hours from when stroke symptoms first appear or from the last time the person was known to be well. If someone arrives at the hospital after 4.5 hours, they may still be evaluated for treatment, but only in special cases with advanced imaging and the guidance of a stroke specialist. Generally, those presenting after 6 hours are not considered for tPA but may be candidates for other treatments like endovascular thrombectomy. Next, a confirmed diagnosis of acute ischemic stroke is essential. This is typically established through a clinical evaluation and brain imaging, usually a computed tomography scan, to rule out hemorrhagic stroke or other contraindications. Another important factor is the severity of neurological deficits. Patients should exhibit measurable neurological deficits that indicate disabling stroke symptoms. If someone has only minor symptoms, they may be excluded from tPA treatment. However, if the deficits are potentially disabling, tPA might still be considered. Severe strokes, indicated by a National Institutes of Health stroke scale score greater than 25, may also be a relative exclusion due to a higher risk of bleeding, but decisions will be made on a case-by-case basis. Exclusion of hemorrhage and other contraindications is critical. Patients must show no evidence of intracranial hemorrhage on brain imaging. Additionally, recent intracranial surgery, head trauma, or bleeding disorders can disqualify someone from receiving tPA. Recent major surgery or trauma within the last 14 days, active internal bleeding, or known bleeding tendencies are also significant concerns. Blood glucose levels must be above 50 milligrams per deciliter to ensure safety. Blood pressure control is another key requirement. Before administering tPA, blood pressure must be managed to be below critical thresholds, typically less than 185/110 millimeters of mercury. Age and other medical conditions also play a role. Generally, only adults aged 18 and older are considered for tPA. Certain health issues, such as a recent stroke within 3 months or serious systemic illnesses, may also exclude patients from treatment. Imaging criteria are also important. Brain imaging, either through computed tomography or magnetic resonance imaging, must show no signs of hemorrhage and limited early ischemic changes. Advanced imaging techniques may be utilized to identify salvageable brain tissue in cases where treatment is considered beyond the typical time window. Finally, a rapid eligibility assessment by a physician with stroke expertise is essential. This can happen on-site or through telemedicine, ensuring that patients are selected appropriately and that treatment delays are minimized. In summary, eligibility for tPA involves confirming an ischemic stroke within a narrow time frame, ruling out hemorrhage or bleeding risks, assessing the severity of the stroke, and ensuring controlled blood pressure. All these criteria are designed to optimize patient outcomes while minimizing the risk of serious complications like intracranial hemorrhage. Individual patient factors and expert consultation are vital in making the best treatment decisions. Always consult healthcare professionals for personalized medical advice.